So would you please welcome Ross Coburn, Chair of the Council Authorities of Australia.
Good morning, everyone. Thank you, Lynn, for your kind introduction. I'm pleased to see so many people here today for what promises to be an excellent conference following on from the GRA Masterclass yesterday. I had nothing but great feedback from that last night. I would like to acknowledge our special guests this morning, South Australian Health Minister, the Honourable Jack Snelling, our host, State CEO Jason Killens, Martin Bowles, Secretary, Australian Department of Health, Brad Mitchell representing Paramedics Australasia, Marty Nichols and John Brunning representing the Australian and New Zealand College of Paramedicine, Stuart Ellis from AFAC, Dr Michael Sayer, Resuscitation Academy Seattle, Mark Whitbread UK, Steve Irving ACE from the UK, Jerry Schreimer from Paramedic Chiefs of Canada. I'll run out of the page, but if I've missed anyone I do apologise. To all the presenters who have taken the time to be here today and over the past few days, our member services, colleagues and delegates. This year marks the 55th anniversary of the Council of Ambulance Authorities. 5 years ago at this conference in Hobart, we reflected on our achievements, including the adoption of a single telephone number to call in an emergency, the introduction of medical directors or medical policy committees in ambulance services, agreement on a system of triage tags for mass casualty incidents, and a program of accreditation for university paramedicine courses. In the space of the last 5 years, paramedics are closer to receiving their professional registration. We are part of a global network, the Global Resuscitation Alliance, that is striving to reduce the death toll from sudden cardiac arrest, and we have recognised and given voice to the importance of health and well-being of all in our sector. Working with Beyond Blue, we developed the CAA Mental Health and Wellbeing Strategy, a resilient workforce. The individual work from states and territories in this area has been fantastic, and all services have taken up the roles. The momentum to finalise paramedic registration process will continue unabated until laws are enacted. We are likely to see the first registrations occurring towards the end of next year. It's been a journey. It will be a significant milestone for our sector, where paramedics will join our other health professionals to be publicly recognised for their training, skills and dedication. We have been fortunate to work closely with Paramedics Australasia and the Australian and New Zealand College of Paramedicine on the registration process. Their input and collaboration have been invaluable, and we thank you very much. Every year we have seen the demand for ambulance services continue to grow unabated. The National Report on Government Services in 2015-16 confirmed the relentless pressure on services and our personnel. Nationally, in Australia there was 3.4 million incidences reported to ambulance services. This resulted in 4.3 million responses. As you know, there can be multiple responses to a single incident. And some 3.2 million patients were assessed, treated or transported. We break that down into simple language. That's 1 in 8 Australians receive some treatment from the ambulance service. Equivalent data in New Zealand reflects very similar attendance ratios. The types of incidents confronting paramedics and the services are continuing to change. In varying degrees across New Zealand and Australian states and territories, they range from casualties that may be linked to terrorism or lone wolf attacks to alcohol and drug-fueled chaos on the streets. At the other end of the spectrum, we are seeing greater numbers of patients with chronic illness and comorbidities struggling to access the services they need, a real challenge for us all. Through our committees and forums, we continue to address these and other challenges facing the sector on many levels, from education, research and operations to clinical and emergency management. I'm pleased to see that enrolments at accredited paramedic courses in Australia and New Zealand are growing. There was a 13% increase in the 2015-16 year. We have also introduced a new committee, the Mental Health and Wellbeing Group, to maintain a focus on supporting all personnel. It has been a strong focus over the last number of years. The group, along with other CAA members, work closely with Beyond Blue to develop the CAA Mental Health and Wellbeing Strategy, a resilient workforce. I would like to take this opportunity to thank Rob Heslip from Beyond Blue for his tireless efforts in supporting our services to continue this important work. Thank you to all our committee members who have so generously given of their time and expertise to make a significant contribution above and beyond what we normally do in all our states and territories. CAA continues to represent the sector on a number of national bodies, including the Australian Health Protection Principal Committee, the National Health Emergency Management Subcommittee and the National Rural Health Alliance. The importance of our association with these and other affiliated groups is underlined by our conference theme this year, Better Together through Collaboration, Integration and Partnerships. We are better together, which applies equally to our fantastic sponsors and exhibitors. The trade exhibition is an opportunity for us to have meaningful engagement, to provide your feedback on products and services, discuss what the future looks like and your respective roles. These people that are displaying, they're not here to sell you anything. They've already done that, probably to a certain extent. They're looking for your input and feedback. They supply many of the tools that make our livelihood possible. And it's with their support that we can deliver an outstanding event every year. An event that is designed for real collaboration and to forge important partnerships. Thank you to our principal sponsor, Stryker, our platinum sponsors, Laerdale and Wrap Australia, and all our other gold and other valued sponsors and exhibitors who have joined us here in Adelaide. I encourage you to make the time to connect like at Lynn with each and every exhibitor over the next few days and beyond this event. The gala dinner this evening, where we will announce the winners of our Awards of Excellence program, is another opportunity to take stock of our remarkable sector and celebrate its achievements. Individuals, teams and services. We do not celebrate our achievements enough. All of this year's nominations, 29 in total, are summarised in our Special Awards Edition magazine, which will be available at the dinner this evening. I would now like to introduce you to our host CEO this year, Jason Killens from South Australian Ambulance Service. Jason will give you a quick overview of the conference. Please welcome Jason. Thank you and enjoy the conference.